Okay, let's get started. Happy New Year to all of you. Thank you for coming in to today's webinar on bra, neck, and shoulder pain. And thank you for all the gentlemen out there who take courage to attend today's webinar, because some of you might be wondering, is this webinar just for female who needs to wear a bra, of course, but what are the male here doing inside? So I want to applaud and congratulate the male here who are attending today's webinar, because either you are attending here today because you care about your loved one, could be your wife, your girlfriend, or your mother who is wearing bra with neck and shoulder pain, or you're a trainer who's training clients with neck and shoulder pain. You've been trying to help them, but you don't know why they keep having neck and shoulder pain. So today, let me be the one to help you to solve all this mystery. Now, before I review you the secrets and some of the good solutions, I'd like to officially introduce myself by playing a 1-minute quick video. At least you know why I can share about fixing pain and why I talk about bra, okay? So just a 1-minute quick video, bear with me. Okay, so there's a quick snippet of who am I. I've been in industry for 23 years. My passion is enjoy helping people with all kinds of musculoskeletal pain. I'm also a peak performance coach. That means I help people to address their all kinds of pain and train them for peak performance. Peak performance can be you want to play better golf, you want to chase after your grandchildren, you want to excel in your sports, fat loss, body transformation, all kinds. So I train children as young as 4 years old to elderly as old as 90 over years old. So today I'm very excited and passionate to share with you what is going to hopefully give you some good insight and solution on how to live your life and live a pain-free, active life. Okay. Let's move to the next slide. Okay, this is an interesting slide that I like to touch on quickly. This family here, why and how they can live pain-free actively. This is the father, which is the center, called Vincent. The wife is at the left and the daughter is at the right side of the picture. You can see them having a very happy family face. But prior to this, they actually went through a lot of trouble and sadness and couldn't live properly as a family. I want to share this quick story with you to hopefully inspire you. It'll take about 3 minutes or so to let you know that in case you are one of them that's suffering with any kind of upper limb pain, like neck and shoulder pain, arm pain, or whatsoever, you are not discouraged, because there's always solutions. So let me just share this 3 minutes short testimonial with you. Then we'll go straight to the bra, neck, and shoulder pain. Okay, I promise you. So let me just highlight quickly. Okay. Let me just read out the testimonial.
Personal training client, Wias, Vincent and mum-in-law. Age, 45. Occupation, civil servant. Personal trainer, Nelson Chong. Nelson is very clear in his explanation and has helped my daughter, myself and mother-in-law with our physical pain. My wife's friend, Appalese Po, referred my 16-years-old daughter to FTI because she was experiencing unbearable pain and weakness on her entire right arm. She was unable to write for close to 2 months and missed her year-end exams. The pain gotten worse daily and affected her sleep and daily function, and no doctor could explain what was wrong with her at all besides prescribing her more painkillers. Nelson is very meticulous in addressing my daughter's issue and applied manual trigger point therapy together with highly effective corrective exercise to stabilize her condition. Within just a few sessions, she was able to pick up her pen and write progressively from a few minutes to half an hour, and now continuous writing without pain. We were totally amazed and grateful to have found him. Personally, I have been suffering from rheumatoid arthritis for many years, resulting to swollen and painful limbs that limited my mobility and daily function. The pain at my upper limb was affecting my sleep every night, and I was losing grip strength daily and experiencing tingling sensation down my both arms. I was also experiencing pain at my ankles and knees while doing simple things such as walking, climbing stairs, and could not get down or get up from the floor on my own at all. After Nelson taught me how to apply his unique R4 methodology to release and retrain my tight and misaligned body, I am very happy that I can finally live pain-free actively again in just few sessions without any medication. Best of all, the swelling has gone away and I am now able to get down and get up from the floor easily on my own with better mobility. I could also sleep much better through the night, and my shoulder mobility has improved significantly too. I decided to bring my mother-in-law who has chronic knee pain. Similarly, her condition has improved after applying R4 methodology in just 2 sessions. We highly recommend anyone with pain or sports performance issue to FTI, as they are really professional in empowering individual live pain-free actively.
Okay, thank you for your patience to go through the testimonial with me. Just like I say, a lot of you might have experiencing helplessness and suffering in pain for many years. I just want to encourage you that things are quite simple. Once I review to you some of the solutions that I deal with my clients, you'll be surprised that they can be fixed quite easily. So let's move on quickly to the actual topic of bra, neck, and shoulder pain. Now, before that, I want to share some common types of upper limbs issue. Upper limb means neck and shoulder, elbow, wrist. So these are the common terms that people use when you go and see the doctor with all the scan, the MRI, and the X-ray. They will tell you that maybe you have one of the symptoms here above, like cervical spondylosis, migraines and headaches, stiff neck, thoracic outlet syndrome, rotator cuff tear, frozen shoulder, tennis elbow, golf elbow. Maybe you have tingling and shaky arms, you have weak grip, you can't open a bottle, you have wrist pain when trying to do a plank on the floor, you have carpal tunnel syndrome, etc., etc. So these are all the very scary and intimidating diagnostic terms that they try to tell you what's wrong with you. But more importantly is finding the solution and the cause of the problem. Now, in my 23 years of helping people, I realized that once you restore the shoulder girdle alignment, meaning your scapula, your shoulder blade alignment, a lot of problems can be fixed pretty quickly, honestly. So on the right-hand side of the picture, you can see here, I put brachial flexus nerve, which is connecting from your C4 to T1 cervical point number 4 to thoracic number 1. It actually passed through from your neck, connecting from your neck through the collarbone, through your deep chest muscle to the entire arm, all the way to your fingers. So meaning if any part of your body, be it your neck is tight, the muscles is tight on your neck, the muscles is tight on your chest, or the muscles is tight on your forearm, all these can compress your nerve, giving you aches and pain and tingling sensation and whatsoever. So why are all these muscles being tight easily? I will show you some of the reasons in the next following few slides. Then you know that by restoring the shoulder, it can improve a lot of condition that has been bothering you for years. Okay. Now let's look at review the source of the pain, which I call it. When we talk about review the source of the pain, meaning we're trying to find out what exactly is causing you to have pain. So a lot of time people has neck and shoulder pain. They keep looking at the neck, thinking the neck is the main issue that's causing the pain. Actually, I put it down here. Stop looking at your neck. You need to check your T-spine, meaning your mid-spine, your thoracic spine, and your scapula, meaning your shoulder blade in layman terms. Now let's look at picture number 1, a lady wearing a bra. Now this is a normal bra that most lady will be wearing. It's called a double strap bra. Now, if you look at the picture, this might look like you if you take a back view of the picture wearing a bra. You might not see anything abnormal about this lady wearing a bra. Let me break it down for you to see clearly. On the left shoulder is a healthy shoulder. On the right is a dysfunction shoulder. That means this lady will have a lot of aches and pain on the right side of the neck and shoulder. Now, why is that so? Let me review to you layer by layer. Now, a healthy shoulder, you can see here with the red line drawing across the top of the shoulder blade. The shoulder blade is called the scapula, by the way. The top of the shoulder blade should be sitting at T2 or T3, meaning thoracic spine, number 2 or number 3. Now, if you look at the right shoulder blade, they are very obviously sitting below T2 and T3. That means the shoulder blade is sitting in a depressed manner, dragging your neck. When our shoulder blade is sitting too low, it's constantly tugging your right neck, giving you constant neck and shoulder pain. And not only that, when you try to raise up your arm in the air, that's where you will pinch your shoulder joint, causing the rotator cuff injury. So point number 1 is your shoulder blade need to sit at the right height, which is T2 and T3. If it's sitting too low, you will see your friend or yourself having droopy shoulders, meaning your shoulders are sitting too low with a very steep angle. And for women, when you have that problem, when you wear your bra, you find that your strap keeps dropping off, or you wear your sundress, spaghetti dress, you'll find that you tend to drop off the strap all the time. But not to worry, there's a solution to help you to restore the positioning of the shoulder so you look good. Even though you are born genetically with droopy shoulder, it can be corrected. Now let's move on to problem number 2 on the shoulder blade. Looking at the same picture, you can see that a healthy shoulder blade on the left side, the shoulder blade center line, meaning the border of the shoulder blade should be 3 inches away from the spine. Okay, I say again, the border of the shoulder blade, which is the scapula, should be 3 inches away from the spine. So if you look at the left shoulder blade compared to the right, you will realize that the right shoulder blade is sitting way too close to the spine. Hence, you can see the shoulder blade popping out away from the rib cage, which is what we call winging scapula. That means the scapula is winging out, it's popping out. It's due to a weak serratus anterior muscles and tight infraspinatus rotator cuff. So all these will cause a lot of shoulder dysfunction, neck pain, and shoulder pain when you try to do your day-to-day movement or exercise. So now, what's the reason of the bra in this case doing with this thing? Now, if you are having a water bottle or a handphone on your hand, I want to do a simple experiment with me. Anything. Now, when you hold a handphone very close to your hand, if you see me talking now in my video, the minute you hold your hand here, the object on your hand here, be it a handphone or a water bottle, is the same weight. Let's say a handphone is 250 grams or 200 grams, be it iPhone or Samsung or whatever. The minute you stretch out your arm away from the body, this weight can easily multiply by 10 times. That means instead of 250 grams, it can become 10 times. That means 2.5 kilograms perhaps. Okay, so what has this got to do with the bra that I'm trying to talk about? So you have to understand, we look at the bra again here. This is a double strap bra. So if the bra strap is pulling down your shoulder very close to the extreme end of your shoulder blade, it's the same theory as the handphone theory when you put it far away from your arm. So the further away the strap of your bra, away from your neck, that means closer to your shoulder, the more it will depress your shoulder blade, which is the scapula, causing it to constantly being pulled down. So when the shoulder blade is sitting too low, it will constantly drag your neck, giving you a lot of constant neck and shoulder pain. And not only that, the double strap bra also restrict your scapular movement because the strap is actually pushing against the shoulder blade, restricting the shoulder blade to move freely, which I'll show you a separate video later. Okay, so I hope so far you're getting what I'm trying to tell you. Okay, let me show you another picture, the second one, then you will understand. Now, this is the second one, which is this is a deep example of a nursing bra. So when you wear a nursing bra, try to buy a nursing bra that is not a double strap bra. I'll show you what is not a double strap bra in a while. But in the second picture, you might see nothing wrong with this lady. She looks slim, she looks pretty, sexy, whatsoever. But there's something absolutely wrong with this lady. Let me review to you. Same thing, the left shoulder, her right shoulder blade is the one that's dysfunction comparing to her left shoulder. Why is that so? Let me show you the line. Now, under a healthy condition, our collarbone, in this case, we talk about the collarbone now, our collarbone starting from the center line towards the shoulder should be angled slightly upwards. So in the picture that you see, her left collarbone is the healthy one because it's angling slightly upwards about maybe 5 to maximum 10 degrees. This is the healthy shoulder. Whereas her right collarbone is almost parallel. So meaning she has very square shoulder, which is not supposed to be. Under the condition, she also will develop a lot of constant neck and shoulder pain because her shoulder is not sitting at the right position due to the collarbone is not angling slightly upwards. Okay. So we talk about shoulder blade, we talk about collarbone. All these are causing a lot of neck and shoulder pain. So what is the correct bra that we should be wearing as lady? Let me review to you. This is the third picture that shows you exactly the type of bra you should be wearing, especially women with big breasts. It is very important because the heavier the breast, the more the gravity is pulling down, the more stress on your trapezius, which is your neck muscles and your shoulder blade. So why a razor back bra will serve you a good cause without causing you a constant neck and shoulder pain? Because you can see when you wear a razor back bra, first, the strap that is on top of the bra is closer to your neck rather than away from your neck all the way to your shoulder. And also the strap is also thicker. It's not very thin. Unlike the normal double strap bra, the strap is very thin, maybe less than 1 inch or maybe half an inch. Whereas the razor back bra is usually thicker. It can be up to 1 to 1.5 inch or even 2 inch, depending on what brand or what design you buy. So for ladies, if you are intending to buy a razor back bra, please buy the support strap should be thicker, not too thin. It can be multiple layer, like for maybe some people buying from Lululemon or whatever brand. You can see some of them, there's multiple layer, which is fine. But you buy a single strap, it's still no good because the pressure is still strong when you have a single strap. So under the razor back bra, you can see that the scapula, meaning the shoulder blade, is free. They are no longer being pinched or pressed down by the strap. It's free to move the shoulder blade. So when the shoulder blade on both ends are free to move, they can function healthily, which I will show you a separate video in a while, why the shoulder blade need to free to move from 0 to 60 degree. Then you can restore the full movement for your yoga pose in a downward facing dog, or your shoulder press in the gym, or the pull down in the gym setting in a while. I'll show you. So razor back bra is the way to go. And surprisingly, there are not many places selling a normal razor back bra. I'm not talking about sports bra. I'm talking about normal bra that you wear for your daily wear, not even talking about sports razor back bra. It's quite difficult to find in Singapore when I do a research, surprisingly. And for those mothers who are breastfeeding, especially when you give birth, your breast is going to grow bigger due to the milk you produce to feed the baby, try to wear a razor back bra, because if you wear the normal strap bra, you'll realize that you're going to develop a lot of neck and shoulder pain when you go through the first time becoming a mother, okay? Now, here is a very interesting question which I want to ask, and I hope all of you will participate because I will reveal to you the importance and the secret behind it. You see here picture number 4, a lady wearing a bra. So I just want to get some statistics. If you don't mind helping me to do me a favor, I want you to type in the chat group. If you wear bra to sleep, type yes. If you don't wear bra to sleep, just type no. Okay, I give you 30 seconds. If you are still wearing bra to sleep every night, type yes. If you are not wearing bra to sleep, please type no. Okay, 30 seconds from now. Now, if you are a man and you know your wife is wearing bra to sleep, type yes, because your wife is not at this webinar. So if your girlfriend, whatever, okay, you can. Okay. Good, thank you for your participation. Now, why this question is important? Because surprise, surprise, even till this modern age, I've seen people with frozen shoulder and whatsoever coming to me for help. And surprisingly, there's still quite a lot of people wearing bra to sleep as an adult. And this is important because if you are a mother, you're still wearing normal bra. I'm not even talking about sleepwear. You're talking about a normal bra, no normal bra that you wear at daytime, you still wear to sleep. your daughter will follow you the same habit of wearing a bra to sleep. Now, what's the relevance of talking about this sensitive topic? Because when you wear a bra to sleep, you cannot breathe properly. That's number one. Because when we breathe, our rib cage is supposed to expand 360 degrees. It's supposed to expand forward, backward, and sideways. It's supposed to breathe normally to get more oxygen, blood flow to repair your cells, your tissue, and whatsoever. So when you wear a normal bra to sleep, your rib cage is being jammed up. They cannot relax and breathe and function optimally. So your sleep become very compromised. That's one thing, because your bra stripe and the one that is holding your rib cage is compressing it all the time. Now, secondly, because of the strap that is constantly pressing down your shoulder blade, which is during the daytime we talk about, it's really holding it all the time, depressing your shoulder blade. So if you keep wearing that to your sleep, you'll never have a good sleep because the restriction and blood flow is constantly holding your shoulder blade down. And plus, when during our sleep, we really lock in our position, that make it even worse. So for those of you who has neck and shoulder pain and still wearing bra to sleep, I strongly encourage you, which I did to my client, which I felt the difference. I strongly encourage you really try to sleep without the bra for a few nights and see what happens. And if your children or your daughter are doing it, please tell them don't do it in the nighttime. So let them sleep freely and let the shoulder move freely. Okay. Now I'm going to move on quickly to the next one, which is let me bring out the picture. Okay, the next one is sleeping sideways without bolster. Now, same thing, I'm going to ask this question in the chat group. Please help me to type in the answer so that I can interact with you. Now, if you are a side sleeper, meaning you sleep sideways rather than sleep flat, you're a side sleeper, do you have a firm, long bolster, not pillow, a pillow not counted? I talk about bolster that is cylindrical shape. Do you use a long, firm bolster when you are a side sleeper? Please type yes or no, okay? If you are a side sleeper, yes, meaning you have been using a long, firm bolster. No, no means you don't use a bolster, maybe you use a pillow. Okay, 30 seconds, please type yes or no in the chat group so I can know what is going on. Okay, thank you very much for your participation. I really appreciate it. Now, why for ladies sleeping sideways, you need a long firm bolster and not a pillow? Because when you use a long firm bolster, not only it can support in between your thighs, meaning your knee won't be dropping down. Because if your knee drop down, you will constantly drag your hips, you will have back pain. Interestingly, yesterday I was doing a Zoom session with my trainers, and there was one female trainer who has constantly front hip pain and buttock pain for many, many months. And yesterday, we found out that during the Zoom session, when I'm looking at how she sleep on her bed and her bolster, her bed was too soft, and second, her bolster was also very, very soft. And I actually suggested her to try to sleep on a different bed in her house. And this morning, she shared with me her pain significantly reduced just by changing to a firmer bed. She haven't even tried to change to a firmer bolster. So imagine after she changed to a firmer bolster, what changes she will be going through with less back pain and knee pain and all those things. Now, how does it go to do with the shoulder? Same thing, if you see in the picture of this lady sleeping, if you don't have a bolster to hug around your chest, you will further collapse and enclose your shoulder rounding off. So your chest is going to tight, your shoulder further going to impinge. So that will cause a lot of problem. That's why you need a bolster to prevent your body from over collapsing. So please get a good bolster if you are a side sleeper, and it must be a firm one, not a soft one. It shouldn't be a pillow, okay? Now, and also for lady, if you like to, most lady like to carry bag on only one side of the body, which is an issue, because if you carry only one side of the body on the shoulder, your shoulder tend to lurch forward, what we call slouching forward. This will further tighten your chest and your trapezius and causing a lot of problems. So try to always hold on the elbow, which is easier without straining your neck, and it will be better to use a backpack. But ladies, as we know, they don't normally like to use a backpack. They like to use a handbag. So always carry your handbag on the elbow rather than on your shoulder. Okay. Now, the last picture here is picture number 7. This is an interesting one because a lot of people with neck and shoulder pain didn't realize it's coming from the way they walk. I call the ape walk. Ape walk means walking like a monkey. Now, human, when we walk, our hands should be facing inwards towards the thigh. It doesn't touch the body. Our palm should be facing inwards. But monkey, when they walk, if you see, the hands are facing behind the body. So this lady here, you can see when she walks, her palm are totally facing backward. I'll show you a short video, then you can get a glimpse of it. So I'm going to move the video in frame so you can see every time she land or walk on the right leg or left leg, you can see her palm is facing backward. Even when she land on her left leg, her palm is still facing backward. Okay. Now, the interesting thing is this lady had a lot of pain around her neck and shoulder and even her whole arm. Now, interestingly, when she lands on her right foot, you can see her upper body, which is her shoulder blade area, has not much rotation on her T-spine. But when she lands on her left leg, you can see there's more rotation on the T-spine, meaning she's rotating to the left with her shoulder blade and her spine, which is good. But on her right leg, when she lands, there's not much rotation on the right side. So this is a walking gait dysfunction. Very clearly, you can see not only her hands are pointing backward, her spine is not rotating equally. Hence, this lady has been suffering with pain for very, very long. So why am I showing you all these important facts? Because simple thing like walking, because if you walk like a monkey and you keep pacing your palm backward, you're constantly rotating your shoulder inwards, tightening your chest, tightening your lats, which is your back muscles at the same time. That will constantly drag your neck, giving you a lot of neck and shoulder pain and restricting your range of motion of your shoulder. So hopefully you get some good insight on this picture slide itself. So a quick summary on this. Our shoulder blade, the top of the shoulder blade should be sitting around T2 to T3, thoracic 2 and 3, to have healthy shoulder without pain. And the shoulder blade should be sitting 3 inches away from the spine. Our collarbone, normally as sitting or standing, if you see yourself in the mirror brushing your teeth or whatsoever, changing your clothes, you should see your collarbone angling upwards a little bit from the center to the outwards. If you see your collarbone very horizontal, chances are you should have some shoulder and neck pain, which we see all the time for our clients. But all these can be treated, okay? Now let's move to something extra to give you more good information. Now, assuming you, for men we don't wear bra, of course, okay? But why do we still have neck and shoulder pain? Okay, many reasons. Because during COVID, due to digitization, a lot of people do Zoom and whatsoever, which you all are doing Zoom now. You realize that a lot of bad habit, like we can use our laptop on the bed, on the sofa, on the floor, using our handphone on the sofa again, and using an ergonomic chair in an improper manner. All this is going to cause our chest and shoulder, our chest and the abdominal muscle to tighten, bending and like a banana shape. So when this happens over time that we use for hours and hours every day, it will just keep dragging your front, which is your chest and your abs and your hips, all to be very tight. So by the time you want to lift up your arm, you're being jammed. You want to train your other muscle group, you find that you have start to have back pain like slip disc. I want to show a quick story here. Let me open up the picture here. An interesting case study here. Now, this gentleman here, he came all the way from London. Now, interestingly, he has been training with a personal trainer for years. He's in a chiro, he's in a physio for 6 months. He keeps having constant neck and shoulder pain. So during his holiday trip to London, visiting his friend referred him to come and see me. So I go through his lifestyle and everything. I asked him how many hours he worked in the office or at home and whatsoever. I even asked him whether he has a good ergonomic chair that is used at home. He said, yes, I have an ergonomic chair. So I say, go ahead and show me how you use your ergonomic chair. So when he sit down on the ergonomic chair in my office, which is similar to his, this is what I observed. You can see, number one, he's not using the armrest that is adjustable. He's not resting the elbow on the armrest. That's number one. Now, if you don't rest your elbow on the armrest, you're constantly tightening your latissimus dorsi muscle, which is your back muscles here. So your latissimus muscle, once you tighten, you will restrict your mobility of your shoulder, meaning your arm will not be able to raise up to the air once it's constantly shortened in a locked short position because you use hours of computer and laptop or whatsoever. Number two, he is not totally at rest. He's not using the neck rest with the neck resting on the neck rest. Number three, his hands were too far forward to reach the keyboard, and he's bending forward to look at the screen. So his chest and abs is constantly tight, and because he's reaching his arm too far forward, his chest muscles are constantly in an isometric shortened position. So that further drag along his trapezius, which is his neck muscle, causing him to have constant neck and shoulder pain. So how do we prove that? Very easy, because when we look at the posture and we took the photo, you realize that his left shoulder is sitting lower than the right. Okay, from the posture photo that we take, and when we do the movement review, you can see from here, the left elbow is more bent than the right, meaning it's more restricted. Both are restricted, but the left is more restricted. And when we further do this simple test here, you can see when he tried to raise up the arm, he couldn't touch the wall completely at all. And when we do an external rotation, which is at the bottom right picture here, the arrow pointing down, you can see his left arm doesn't pass the ear at all. It cannot cover the ear, whereas the right arm can cover the ear. So the right arm is also tight, but the left arm is very, very tight as compared to the photo here. So why am I telling you all this? Because if you can't even raise up your arm to touch the wall behind you, or even rotate your arm to touch the wall behind you, imagine you go to the gym, you do a downward facing dog in a yoga class, you do a shoulder press in the gym, which he's doing with his trainer, or do a lat pull down machine or chin up or whatsoever. You will keep aggravating your rotator cuff, which is the supraspinatus tendon. That's why he has shoulder pain, and you keep using the wrong muscle because you do not have the shoulder mobility. You'll keep firing up the wrong muscle. So all this could be treated easily just by finding out the source of the problem, teach him how to use the ergonomic chair properly, release the tight muscles accordingly, retrain the weak muscle accordingly. Okay, solution is simple and straightforward. Now here I also start example like this person here doing cycling. I'm not against cycling, like I say, during COVID, a lot of people pick up cycling, but if you only do cycling for the rest of your life and nothing else, that's what's going to happen. You're going to have a lot of neck tension. Your abs and your chest are going to be very tight. Same thing go to your tricep because you're pressing down the handle. So end up you will have a neck and shoulder pain and back pain very soon if you only do cycling for the rest of your life. I have many clients that come and see me with back pain and slip disc because they do only cycling and nothing else. So once we teach them and restore their pain and no more pain, we tell them that you can go back to cycling by doing the reverse of cycling, meaning you need to do more back exercise, extension exercise accordingly to reset your body. Okay. Now here's an interesting picture in case you haven't seen it before. You can see when the person is standing neutral, the head weighs about close to 5 kilos while using your phone. But typically, when we use our phone, you walk around the street, in the train, in the MRT, in your office, you'll see a lot of people tend to bend their head forward. So the more you lean your head forward like a bowling ball, you lean forward, you realize the weight, instead of 5 kilo, it can become 10 times more, which is 50 kilograms. And because it multiplied by 10 times more, all the muscles behind your neck, your mid-back will be overdeveloped, trying to resist your head from falling to the floor, resist against gravity. Hence, you can see some people will start to develop what we call the Dowager hump. The muscles behind the back start to overdevelop, and not only overdevelop, giving you a lot of neck and tension headache. So this is one of my clients, which I capture by chance that he was waiting for me. Then I saw him bending over using his handphone like this, which is exactly like what you see in the picture. So when I show him this and I told him he should change his way of using the handphone so that it doesn't keep straining the neck. So for those of you who are using a lot of handphone, you need to watch your posture. Try to rest your arm on the tabletop. That will be helpful. Okay, let's move on. Now, many other reasons for people with neck and shoulder pain. It can be your spine that is very hyperextended lower back, causing your upper back to round off. That can give you a lot of tension compensation on your neck and shoulder, and even give you headache and migraine beside back pain. It also can be your spine is C-shaped curve like a banana. So due to your lifestyle, sitting a lot on the bed, on the sofa, watching your movie and things like that, or using your phone or reading a book on the bed, all these are very bad habits that I mentioned briefly last webinar. So by lying down like a banana shape, you don't only get flexion related back pain, you also definitely get a lot of restriction in your shoulder mobility, causing a lot of compression into your neck and your rotator cuff, which I will do a short demonstration with you in a while. The third group of people is they have neutral spine, but why they are still in pain with the neck and shoulder. I will also review the secret that I deal with very chronic clients in pain. They look normal, but they're in pain. They don't know why, and they love to exercise. They're still in pain. Okay. Now we look at the client with a very C-shaped curve first, like a banana shape, why they are in pain. And I want you all to participate with me to do this simple experiment. Now, you can see my client here doing a test. We call the shoulder flexion test, trying to reach your arm to the wall behind you and see whether you can do that. So I want you all to see me to do this test with me. Hang on. So it's very easy to do. So see my screen. So what I want you to do, you follow me. Now imagine you're sitting up right now, okay? Watch me in the screen. You try to sit upright, your spine, and you try to raise up your arm and see whether you can reach your ear, okay? Everybody try that for a few seconds. You see whether you can keep your elbow straight. Do not bend your elbow. You must keep your elbow straight and see whether you can reach your ear and any discomfort. Okay, some of you might have one arm able to reach, some of you one arm couldn't reach, okay? Now, do the next test with me. Now imagine my spine is hunched because I keep using my laptop, I keep cycling only, my spine is very hunched. So I want you to purposely follow me. If you slouch your body like a hunch, like a C shape, you lock in your spine and you try to lift up your arm now. You'll find that there's no way you can lift up your arm. You feel very irritated and jam, and even to the point of pain, no matter how hard you try, until you straighten the spine, you'll feel that your shoulder is free again. Okay. So now why am I explaining this to you? Because a lot of people did not realize that when they have shoulder and neck pain, they keep seeing a lot of specialists, seeing a lot of masseuse, they keep massaging the neck, they do cupping on the neck, they do needling on the neck, they do all the thing on the neck. But when these people come to me, I don't do the neck. You know why? Because the source of the problem doesn't come from the neck. It comes from your chest that is overused. It comes from your abs that is overused because the chest and abs is pulling your spine forward, reducing the joint space here, what we call the subacromial space. So by the time you want to lift up, you keep tearing your rotator cuff tear called the supraspinatus. Also, that is one of the reasons. Okay, now. So in short, if you have restricted range like this gentleman here, which is my client, when you want to lift up your arm, you will keep banging your arm against the roof here, which is your collarbone here. Hence, you will actually pinch your supraspinatus tendon, your rotator cuff, giving you a lot of pain and discomfort. And more importantly, you also use your neck muscles in a compensated manner, hence giving you a lot of pain and dysfunction. So let's continue. Now, you look at here, this is what I'm trying to demonstrate, and this is what my client was only able to achieve. Now, if you have only this range, now take this advice seriously, because these are very good tips for you to help yourself to live pain-free actively. Now, if you fail this test, which is called shoulder flexion test, and you still want to exercise, go ahead and try. Chances are when you do this exercise, which is what we call a downward facing dog in a yoga class, you'll find that because you fail this test, when you go to a downward facing dog, you won't be able to do like what you see in this picture, but you still want to do it. You force yourself to do it because you're in a class. So what will happen over time? Your rotator cuff here called the supraspinatus will start to wear and tear prematurely, giving you a lot of pain and dysfunction because you do not have the range. You will just compromise and bang onto the roof. And you also get bursitis and tendinitis. Now, what about some gym goer who like to do shoulder press in a group class? Can be body pump, can be HIIT using dumbbell or barbell. It's the same. Whether you are doing a downward dog or you're doing a shoulder press with a barbell or dumbbell, you don't have good shoulder mobility. You keep doing all this exercise in the class or with a personal trainer who didn't know, you're going to shear tear your shoulder sooner or later and give you a lot of neck pain. After every time you train, you don't know why you have a lot of neck and shoulder pain, which many people have come and see us for the same reason, until we explain to them in a very easy way. The source of the tightness is coming from the chest, the lats, the triceps, and the rhomboids. We just need to release those areas. You'll be able to live pain-free and go back to their exercise routine. Now, what about doing lat pull down? Same thing, if you don't have good shoulder flexion, you do a lat pull down. Every time you do a pull down or a chin up, your arm go up, you're going to pinch your supraspinatus tendon right at the top here, causing you a lot of problem. And also your neck is going to get irritated because you don't have the range of motion. Okay, so very straightforward. Now, next thing I want you to do with me, this interesting exercise. I have my reason for doing it, and I want you all to try, because this exercise will link to another important story. Why, when your spine look healthy, neutral, and you look good, but you still have neck and shoulder pain, you're lost. Like many of my clients, they look good. Even a Pilates teacher, yoga teacher come and see me with pain. They look good, they look beautiful, but why are they in pain? Their spine looks so healthy and beautiful. The body look beautiful, they're in pain, they cannot understand why. So this is the trick that tell you why. So I want you to do with me, watch me in the screen. You put your hand on your head and you try to move your shoulder blade up and down. You try to move up and down slowly, and you compare yourself by looking yourself in the screen, whether your right side and left side is the same. Okay, I want all of you to try for maybe 3 to 5 repetitions. You see whether your left shoulder blade and right shoulder blade, by putting your hand on your head, are they moving the same height? Try it, please. This is very, very important. Okay, some of you will find that both sides can move well. Some of you will feel that one side totally cannot move. You have to concentrate very hard, but you still cannot move. Or some of you, both sides can't move at all. Now, let me show you the next slide and you will know why. This is very, very important. Okay. Now, our shoulder blade, you can see here, is designed to move from 0 degree at rest all the way to 60 degree away from the spine. Remember just now I talked about the bra, the shoulder blade was sitting too close to the spine. Our shoulder blade at rest, it should be 3 inches from the spine, but that is at rest. But when we move our arm up in the air, our shoulder blade is designed to move from 0 to 60 degree. Then our arm move another 120 degree, total you get 180 degrees. Now, just now the test you do on this, if you can't do this test smoothly on both sides, one side is stuck, chances are your shoulder blade is not moving from 0 to 60. They're only moving from maybe from -5. Instead of 0, they are already actually at -5. So they can only move up to maybe 30 or 40, they jam, they cannot move up because the muscles are tight. Can be your rhomboids, can be your tight chest muscle called the pec minor. Now watch this short video here, you will understand, okay? Just a maybe 2 minutes video.
Scapulohumeral rhythm. When we perform shoulder abduction, the movement is made not only in the shoulder, but in other joints that are an essential part of the movement. You can see clearly that with lateral raise, both the scapula and the clavicle participate in the movement. In the first part of the movement, in which the arm is abducted up to 120.
Okay, I'll pause here for a while. So you can see here, this is the front view of the shoulder blade, and that is the supraspinatus tendon. So the shoulder blade is designed to move from 0 to 60 degree. The arm here is designed to move from 0 to 120. Total, these two combined will give you 180 degrees to move up without any pain. But a lot of time when the humerus, which is the arm bone, try to move, the shoulder blade is not moving enough. Hence, it will bang against the roof here called the subacromial space, giving you tendinitis, rotator cuff tear injury. Okay, this is the space here. You can see there's a gap, but the shoulder blade has to move with it. If the shoulder blade refuses to move, that's where you get the pain. Okay.
Abducted up to 120 degrees, the scapula moves almost not at all. At this angle, the humerus rotates externally by 45 degrees. The clavicle elevates 25 degrees through the sternoclavicular joint, and the scapula rotates upward through the acromioclavicle joint by 35 degrees. 25 degrees plus 35 degrees equals 60 degrees of scapulothoracic joint upward rotation. Full shoulder abduction. Scapulohumeral rhythm. Ratio of 2 to 1. For 3 degrees of abduction, 2 degrees from the GH joint, 1 degree from scapular upward rotation. Full shoulder abduction. Scapulo.
So now you can see the shoulder blade move from 0 to 60, the arm move from 0 to 120. Combined, they give you 180 degrees without pain.
Humeral rhythm. Ratio of 2 to 1. For 3 degrees of abduction, 2 degrees from the GH joint, 1 degree from scapular upward rotation. The muscles that perform this movement are the supraspinatus, which is dominant mainly in the first part of the movement, and the deltoid, which is more dominant in the second.
So conclusion, for your shoulder and the arm to move, to go to your downward dog, your shoulder press, or whatever other exercise that is arm above head, you need 5 muscles to function, which is upper traps, lower traps, serratus anterior, deltoid, and supraspinatus. Most of the time, 3 of the muscles are not functioning, which is your upper trapezius, your lower trapezius, and your serratus anterior, and your abs are tight, causing a lot of dysfunction and pain. Okay, so that's why this test is important. That has helped me to confirm many of my clients with that kind of pain and treating their problem altogether. Okay. Now let's move on quickly. Now I'll show you a very important thing, the testimony here from my client. This beautiful lady here, Inshan, and a very brilliant lady who is an MBA scholar. Now, however, she was suffering with a lot of neck pain, especially, and weakness in her arm for many, many years. She even quitted her job for 2 years. She can't work because she was constantly in migraine and headache. Can't even do simple things like preparing a simple meal for herself. Cannot even use laptop for more than an hour and things like that. So she was very depressed, seeing a lot of specialists, seeing 7 physios over 7 years and still cannot recover completely. Now, interestingly, when she finally came to see me, I discovered something that nobody pay attention to, which is her ergonomic. I will show you through the picture what do I mean by that. Hopefully that give you some great insight now. So you can see the picture on the left. This was her before I fixed her pain. So I realized that she was using a split keyboard, which is great. But however, she was using 2 screens, one on the center and one on the right for her work. Now, because she's using center screen and the right screen, she was constantly looking straight and looking to the right, looking straight and looking to the right. So she was using her neck more on one side all the time unknowingly. So that has triggered a lot of tension and pain. Secondly, the screen was too far away from where she was sitting. Hence, she was leaning forward, further straining her neck. So what I did was asking her to change the screen to center and one top, one bottom. That was the first change that I asked her to do, and bring it closer to her face rather than too far away from the face. Okay, that's the first thing. Now, the second thing is, which you will see here, just now the exercise that I asked you to do not underestimate this very, very powerful exercise, because none of the specialists that she saw discovered this problem until I point out to her, which I video. You all can take a look here. So either sitting or standing in an upright position, okay, no hunching. You can use a yoga block or tissue box between your forearm above the elbow. So you push forward through the armpit, you shrug your shoulder blade, and then you reach up and turn your arm, as in external rotating your shoulder joint. Okay, so as you shrug, make sure both sides are evenly struck, especially your right side a bit slower. You need to bring up your right side a bit more. Yes, better. You can see from your video I'm going to send you, your right need to be more activated a little bit, or your right is a little bit slower, so pay attention to that. Make sure your right move the same time as your left. Yeah, especially when you're shrugging. Better. Then you go up and external rotate. Very good. So do 10 reps. No need to do too much. So you can see from the video, very interestingly, her right shoulder blade was not moving in sequence as the left shoulder blade. So if I were to show you one more time quickly, now take note, just let me mute this, hang on. So you can see when she moved, okay, there was slight delay in her right shoulder blade when her arm is moving up, or even when going down. Look carefully, her right shoulder blade is not moving as timely as the left shoulder blade. So that means her right neck is constantly being dragged down by her right shoulder. Hence, she always have neck pain, headache, and migraine, even with painkillers. So we just need to restore this range by doing this yoga block upward rotation exercise. And by the time she saw me the third lesson, a lot of things has been stabilized. She can move, she can cook, she can do a lot of things. And this is her workout at the third session with me, which she is very, very happy. Okay, I just want to show you what do I do with her in a typical workout. So Inshan also has a bit of collapsed arches and knee pain. So we treated the whole kinetic chain from feet to the paw, to the shoulder, to the neck, the whole kinetic chain. We didn't just fix chronic neck and shoulder problem. We fixed everything using elastic band, using functional strength training, incorporating balance and strength all together. Stability, opening up the spine, improving the feet. He was very concerned that he can't do exercise like this initially because of all the trauma she has gone through. She needs to work out. She's a very adventurous lady. Until I proved to her it can be done, she can be active again, because we reset her whole entire body before we load her system using the R4 methodology. Fully functional, integrating from her feet to her hips to her core to her shoulders. It might look easy to you, these exercises, but when you try it, then you realize it involves a lot of stability, balance, alignment. It's not as easy. And more importantly, it helped her to really pain-free very fast within 3 sessions, which she has suffered from 7 years in pain. All these exercises are carefully thought out and planned according to what her body needs, rather than what she wants. I always say, train what your body needs, not just what you want. Okay, hopefully that give you some inspiration and insight. Wherever, how long you've been suffering in pain, you can all still live pain-free. Hang on. And how come my screen pop out? Okay, let me finish just one more slide. I know time is coming almost to the end. Now, why all these people can live pain-free is because our unique R4 bulletproof system, which include the first R, which is what we call review, the source of the pain. We analyze your posture, your movement, and also your lifestyle, like what Inshan and many of the rest of the people with arm pain, shoulder pain, back pain. Then we teach you the second step, which is how to release your cause of the pain. Then we retrain your body alignment, which is have a glimpse of what Inshan was doing to realign your foot, ankle, knee, hip, spine, all the way to the shoulder. And hence you will be able to get the long-lasting result, which is exercise regularly, normalize your blood pressure, improve your cholesterol, lose fat, build muscle, increase your bone mass, balance, and sport performance. I'm going to play one short video, the last one, to let you have a glimpse of what is R4 all about. Then we have some Q&A, okay? So at least for those who are interested, you know what we do to help you to live pain-free. This is what our clients go through. Okay, the short video you just seen is all our actual clients. They are not paid models, and all of them has previously all kinds of injuries. Some have slipped disc, some has knee surgery, ACL tear before, some has wrist surgery before, some has one of them is a mother of two twins after giving birth, has extremely knee pain and shoulder pain and couldn't function. So they all have their story to tell, but nevertheless, we have treated them through the unique R4 methodology. Now, this slide here will tell you we treat the whole body by recommending you wearing the right footwear, to use a bolster, like I say, and a proper ergonomic sitting. They will help you to relieve your neck and shoulder pain. Okay, I've come to the end of my webinar. Do me a favor, if you really enjoyed today's webinar, I want you all to take a photo, a screenshot of this picture here. One is our FTI Functional Training Skill Google review page, the QR code. The other one is our Facebook review page. Help me to write a review of what you think about today's workshop. Do you like it? Do you enjoy it? What have you learned? And if you want a free 30 minutes consultation via Zoom or also face-to-face, which we are open for sure for the last 13 years, you just send a WhatsApp to this number here, 98209-550. So take a screenshot of this. We will find a trainer to schedule 30 minutes consultation with you to find out exactly your source of the pain and recommend the right solution for you. So take your time to send me a review on the Facebook page or the Google review page, and send a WhatsApp for your free 30 minutes consultation. I will just hang around for the next 5 minutes for any one of you here who want to ask any question. You can type in the chat group now. So once you have a screenshot of this, you can type a chat group, what kind of question you like to ask before. If not, you want to exit to go for your CNY dinner, go ahead. Okay, I will just close this share page so that we can see the chat group. Okay, so any question from anybody who want to ask anything? Okay, I'll just be around for 5 minutes, and maybe I can ask some questions to see how much information you all have retained for those who want to stay back. Like some important, interesting question. I'll throw in this first question to help you all to retain some information. Here's the first question. You all can answer in the chat group. Now, someone still asks about the same question. What about sleeping bra? Is it okay to wear to sleep? If you talk about sleeping bra, unless you're talking about lingerie, like those like almost like a pajamas, but it's not those hugging type of your daytime bra, so it's okay. So what I'm saying that don't wear the daytime bra like a corset bracing up your ribcage and with a strap. Don't wear those bra to sleep. Talk about the pajamas, it's okay. Okay, the answer is correct, is T2. Now, one more question for you, for those of you who are stay back. I want just to see how much you all remember. Okay, those of you who like to participate in this short quiz, go ahead. So how many inches should our shoulder blade be sitting away from our thoracic spine to prevent neck and shoulder pain? Is it 1 inch, 2 inch, or 3 inches? Anybody want to try to answer? Some of you are listening, some of you are not. So the answer is 3 inches, not 2 inches, okay? Question number 3, quick one. Yeah, some of you asked, is it okay to wear sports bra? Of course, sports bra is exactly like razorback bra. Sports bra is for sure okay, yep. Question 3, which type of bra would minimize neck and shoulder pain? Double strap bra or razorback bra? The answer is pretty straightforward, okay? Razorback bra, which is also sports bra. Okay, one last question, okay? One last question. This is a tricky one. See whether who has the best memory. After that, we will let you all go, okay? Last question. Those who are around can try to answer. A healthy shoulder blade must move from 0 to how many degrees when we lift our arms to prevent rotator cuff injury? 30 degrees, 45 degrees, 60 degrees? Okay, the answer is 60 degrees, okay? Now, someone asked this question, if a sports bra is very tight fitting, would it be healthy to wear it full day? Answer is no, because if it's too tight, you wear it full day, same thing, you restrict blood circulation. So usually people wear tight sports bra because they are exercising, as in they jump, they move, or they do impact exercises. So you need good support, which makes sense. But try not to wear sports bra the whole day, unless you are really exercising the whole day, which is unlikely. So I would say wear a normal razorback bra when you're not exercising. That will make more sense. Okay, Ken? So thank you very much for your time. I hope to receive your request and some good review on the Facebook and Google review. I really appreciate your time. If you have anything, just drop us a message. We'll try our best to get back to you ASAP. Have a good new year, a good start, and live pain-free actively. Adios. Thank you. 新年快乐，大家。OK。